The top 10 inherited treatable metabolic epilepsies, the characteristic is that they are eminently treatable. You can treat them. Then second thing is that the epilepsy is the prominent in presentation and the prognosis is linked to early diagnosis and treatment. Bioterin synthesis disorders. Hyperphenylalaninemia may represent a disorder of bioterin synthesis or recycling instead of phenylketonuria. The intracranial calcifications may be reversible with folinic acid. The manifestation of cerebral folate deficiency are, what are the clinical features of cerebral folate deficiency? It is infantile onset, that is 4 to 6 months. There will be irritability, decelerating head growth. So head growth will be slow. Seizures will be there in cerebral folate deficiency. Psychomotor retardation, cerebral ataxia, pyramidal tract signs may be present, and balismus and chorioathetosis will be seen. And after 3 years of age, there will be optic atrophy and cortical blindness. So the manifestation of cerebral folate deficiency are irritability, decelerating head growth, seizures, psychomotor retardation, cerebral ataxia, pyramidal tract signs, balismus, chorioathetosis, and after 3 years of age there will be optic atrophy and cortical blindness. The clinical manifestations of biotinidase deficiency will be biotinidase deficiency. The phenotype, there will be developmental delay, hypotonia, tone will be very low, then seizures, ataxia, alopecia, there will be a characteristic perioral rash, episodic metabolic acidosis. Remember, there is episodic metabolic acidosis. Hearing loss is seen in biotinidase deficiency. This can be asked as MCQ. Hearing loss in biotinidase deficiency. Then similar here, there will be vision loss, optic atrophy, and there is lactic and propionic acidemia. So in biotinidase deficiency, there is hypotonia, seizures, ataxia, alopecia, perioral rash, episodic metabolic acidosis, hearing loss in biotinidase deficiency, vision loss and optic atrophy, and lactic and propionic acidemia. Now coming to serine biosynthesis defect, these are treatable. These treatable serine biosynthesis defects can present with congenital microcephaly, small congenital microcephaly, developmental disorder or epilepsy. The treatable creatine synthesis disorders are sometimes they have a wide and often non-specific phenotype. It's not very easy to diagnose these creatine synthesis disorders because they present very widely. Hyperekplexia is an epilepsy mimic. With a risk of sudden death. You have to remember there is a sudden death is there in hyperekplexia, and this can be mitigated with an oral benzodiazepine. Hypoglycemia with hyperinsulinism may be associated with hyperammonemia and respond to limited protein intake as well as diazoxide rescue when needed. Hypoglycemia with hyperinsulinism, it may be associated with hyperammonemia and it responds to limited protein intake as well as diazoxide rescue. Glucose transporter defect has a widening spectrum and is treated with ketogenic diet as an alternative cerebral fuel to glucose. So glucose transport defect has a widening spectrum and is treated with ketogenic diet as an alternative cerebral fuel to glucose. Pyridoxine and folinic acid deficiency are allelic. Some patients require biological form of pyridoxine or pyridoxal phosphate.